Welcome back to OpenLine. Talking about home health care, talking about how to keep a mother or father or loved one out of a nursing home, how to keep them in their own home. Something many people struggle with as people live longer. We have with us Neil Amrine with All About Care, a home health care business. This is a business that has exploded, right? This industry, I guess, is one that has exploded. And with that, I guess how much regulation is there? Are there pitfalls? Are there things that people should be looking at along those lines? What are we seeing?
That's a loaded question.
Yes, that's a big question.
It is a big question. So the short answer is we've seen in this industry, just in the Middle Tennessee market, go from about 65 or 70 licensed home care agencies to well over 400.
400. So that's a lot.
A lot to choose from, no question about it. And there are more and more folks that want to use home care agencies, but that's there's also some trickiness about selecting the right person or the right agency or partner to come into your home. You know, what, not just the standard background checks, but what kind of questions do you want to ask? How do you want to vet them? And that's important because you're leaving a loved one, you know, who either cognitively or physically is not capable anymore of being totally independent. So there are certain things that we go through in terms of the screening process. Obviously, reference calls, and we have a pretty extensive hiring process. But also, if you're out interviewing on your own and you think that there's a neighbor or a friend or a cousin or someone of that sort that could come by, you want to have a conversation with them about some other things. You know, I would encourage individuals, folks that are interviewing agencies, to ask questions like, you know, what's the backup plan? If that individual doesn't show up tomorrow or next week, or what happens if that person's on vacation? What happens if it's snowing outside? What's your backup plan to come here and care for my loved one?
And what's a good answer for that?
Well,
that's a good question.
There should always be a backup question.
Yeah, there should be.
You also may inquire about insurance, level of insurance. Not only are they licensed or bonded, but also, you know, do they have any claims? Has there been a workman's comp claim? Has there been a general liability claim? Has there been a theft of some sort? There was an article this morning about a local agency that had you know, theft situation, an accusation that took place. And so that can happen even with the vetting process of home care agencies. So I'd encourage families to look at one or two or maybe even three options in terms of agencies if they're looking in that direction. And if they're looking at individuals, you may want to go down the same route that we do, which is, you know, maybe go do a background check on them. And you can do that. I prefer a fingerprint background check versus a name database search, and also to cover, you know, not just the county that you live in or the state that you're in, but Department of Motor Vehicles and so forth. So
with 400, this industry has exploded. Mm-hmm. How regulated is it? Is there enough oversight? You know, what about that aspect of it? Can anybody just open their shingle and say, this is what I'm doing? And is there enough regulation and oversight to give people peace of mind that, you know, this is going to be okay?
Yeah, that's another good question. The short answer is you would hope that the industry and those in the industry would regulate themselves and they would just pursue excellence. And however, there's always going to be a form of mediocrity, and there's always going to be a situation that takes place where you're going to have people doing it for the wrong reasons. You know, and that is disappointing, to say the least, because they are essentially the folks who are providing the care don't have any oversight in terms of the home. There's not a lot of transparency. There's not a lot of accountability. So you have to kind of keep that in mind.
So it's up to the consumer to do the serious vetting, because I mean, with the state, they have lots of things that are regulated, and you say you have a license, and to some people that means something, but you need to maybe take it another step.
I would encourage folks to definitely do that. No question about it.
All right, let's go to Leon. Hello, Leon.
Hello?
Hello, Leon.
Hey, how you all doing this evening?
Great. What's on your mind?
Well, my question was about having someone, you were discussing earlier about having someone come into the home or the apartment to assist with the minor things such as meal preparation, maybe laundry, maybe companionship, maybe things that, the adult person doesn't do, that well anymore. And I was wondering who pays for that, and is it available? Is it available in any type of supplemental insurance packages? How is that financed, and how would you go about setting that up? And that's what I was curious to know.
All right, that's a good question. Thank you, Leon. What about that?
Thanks, Leon. So there are two forms. My home health care organization is a private pay organization. So in other words, families contract with us directly, and we also accept long-term care insurance policies. So that's something that some of those policies that folks have to dust off, and they may have received that policy when they were in corporate America or what have you. And then there are some other government forms of reimbursement through the Choices program. But by and large, most of the industry is private pay. So the non-medical services are not reimbursable, which is the difference between medical and non-medical home health.
So in Tennessee, there was a big push, again, to try and keep people out of nursing homes. Mm-hmm. And so there was some money that was put aside. Maybe it was in TennCare a few years ago, and of course TennCare isn't around as much as it was several years ago, but there was money for, I believe it was nurses to go into people's homes, and maybe that would keep them out of nursing homes, which would be even more expensive for taxpayers. Is there, you're saying there's not really a lot of public money for this kind of thing. Is that right?
There are pockets of it. I don't, my organization is not involved in it, so I wouldn't consider myself an expert in that particular arena, but there are like I said, the Tennessee Choices program, there are monies that have been allocated for home health care companies to get certified and be a partner or preferred partner by the state to provide the non-medical services, and probably contacting the state would be the best alternative to.
So for the most part, it's up to people to pay for it individually, unless they have the long-term care insurance.
Right.
And that's a smart thing to get.
Yeah, it's something that, especially the older the policy, typically the more robust and the policy is. So it would cover, and usually it's a stipend. It has what we would call an elimination period. Could be as few as 14 days, and generally more in the neighborhood of 90 days to 120 days, where services have to start, the care plan has to be defined, and then the reimbursements from the insurance company take place. And it can be a stipend on a monthly basis or a daily allotment. So it could satisfy a 2 or 3 or 4 hour window when your adult child may be at work, where you may need some companionship, a few days a week.
Well, let's go to Brian. Hello, Brian.
Yeah, that's me.
Go right ahead. What's on your mind?
I happen to have a few advertisers of mine at the Nashville Retrospect that happen to senior services. Our readers tend to be over 40, and a lot of the age group is making decisions for their parents and stuff. I know that Belmont Village, the cost per year of some of these facilities, really fine, is extremely high. And is this economically, is for some people, and also personally, they decide to stay at home. But just in the last 5 years, it seems that there's been an explosion in this, and I was also wondering if it's regulated, because I know the senior care facilities are heavily regulated.
Right. Is it regulated? And we talked a little bit about that. And financially, what's a range of what it would cost? But those are good questions. What about that?
Yeah. So I guess I'll start with the regulation component. Within the state of Tennessee, there are what they call PSSA, Personal Support Services Agencies, which is what we're licensed and insured to do, which requires an audit, an annual audit. We come in, we talk, the audit comes in and they discuss our clients, and they have a series of checklists that they go through to make sure that the services match up, and the signatures and so forth, the expectations are set there. So so that is, you certainly want to have an agency, if that's that's what you're looking at, that has that designation. As far as pricing is concerned, it can get a little bit tricky for the consumer. So I'll kind of share with you, without getting into the weeds, kind of the differences in the cost. So the cost can range, I mean, nationwide, anywhere from about $14 an hour, maybe all the way up to $31 or $32 an hour, depending on where you are and what region. It falls generally in the $17 to $19 an hour range. But the lower teen number is typically centered around 1099 versus W-2 employees. So as a 1099 employee, obviously the taxes and the insurance and everything else are taken care of by the employee, by the home health aide, and not necessarily by the home care agency. So just be cautious about that. Having a W-2 employee means you're fully responsible for their whereabouts, for their presence, for their for everything that they do. 1099 is, you're kind of on your own a little bit more, and it's good for some families and not so good for other families.
And is that how it works generally? You pay by the hour. If I wanted to hire a company to come, or your company to come and watch after my elderly parent, would it be okay? Every hour it's X amount, or would I say would it be by the month? Every month it's X amount, or how does that work?
You could do both. Typically it's by the hour, and you can. Some agencies have as few as a 2-hour minimum, where you get somebody in to help with those activities of daily living. Right? The compelling event is we're going to help with the bathing routine and the dressing routine. We're going to do a medication reminder. We may prepare a meal, and then we'll head out for the day and let them start their day, or may help them end their day. There are also denominations of 4-hour, 8-hour, 12-hour, and of course around-the-clock care, 24/7 care, and what you decide, and it can get quite expensive to have that
round the clock
service. That's right.
And we said earlier it's not a nurse. We're not talking about doctors who come in, but you then brought up bathing, and there's some I guess some skills. I mean, you would want some training. How much training is there? And it probably varies company to company. What should people kind of look for along the lines of training?
Right. So there are all kinds of designations and certifications in the marketplace, from CNAs and CNTs and LPNs and so forth. Those designations and certifications have varying levels of CPR training and how do you transfer somebody properly from one location to another. In other words, from maybe their wheelchair to their car, or how do you effectively use and have them use a walker to get out of a recliner and so forth. So those kinds of things, a lot of it seems like it's common sense, but there's a standard, and there are also a half a dozen different ways to effectively and efficiently and safely transfer individuals. And the one thing you want to do is have that transfer technique be the same every time, so that both parties are in the safest mode. So it's as simple as, we're going to take your right foot and we're going to put that forward first. So the cues, that makes a big difference. So we actually specialize and customize every one of our care plans so that the team, in other words, at least 2 of our professional caregivers are assigned to each family for redundancy in the backup plan that I mentioned earlier, but also so that there's some consistency in the care plan itself, and there's personal training that takes place with that. So there's not an unfamiliar face. We don't have someone knock on your door and say, "Hey, I'm Neil. I'm here today for the next 4 hours in your home." Right? So that's important, and that we know you and we know what your expectations are.
I want to talk about that. We're going to take a break now. When we come back, just the employees. I mean, I would think that's probably the toughest, but obviously the most important thing that a consumer should look for in a company like this, and probably for somebody like you to hire employees. All right, we'll take a break. If you want to call in, there's the number, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.